Thank you. So I wanted to start us off here today. This is a quote actually from one of our panelists. We've got Dr. Ed Maibach with us here today. And I wanted to start here because as Australian health professionals will know, this is very true. Every major public health victory of the last century has had effective communication at its heart. It's one of the most powerful tools we have to protect and promote public health. Whether it's successful health campaigns to reduce the widespread use of mercury, or campaigns against big tobacco, or closing waste incineration around the world, or even, well, especially the pandemic that we find ourselves in today, where we're living through a time and we can see the effect of effective communication and how it saves lives, and how not so effective communication can endanger them. So this is no different when it comes to climate change. Climate change is the biggest health challenge of the 21st century. So says the World Health Organization, so said the Lancet in 2009. And we need to, as health professionals, utilize our skills of effective communication to make sure that the links between climate change and health are made clear in the minds of decision makers, the public, and amongst our own profession. So what does effective communication look like? Another mantra of the same panelists here today: simple messages repeated often by trusted voices are most effective. That's what there's a lot of research out there, but that's what the research tells us is most effective to break through what has been a really politicized and really is a really complex scientific issue. And when it comes to trusted voices, health professionals are these trusted voices. Year after year in Australia, health professionals top the list of most trusted professions. This year, doctors and nurses got spots 1 and 2. And this prominence has become even greater since the pandemic has started. We have more health professionals and more health advice on our screens than ever before, and we can see the real world impact of following health advice during an emergency. So we are the people who can deliver these messages and cut through and build on the trust that the public have in us. And there's still so much that health professionals can do to reframe climate change as a health problem. Health is a really persuasive way to talk about climate change. It appeals to people across the political spectrum. It is a universal value. People are taught to value their health from a very early age and to take seriously the advice of health professionals. But are health professionals doing this work? Do they have the resources, the skills, the comfort that they need to do this work? That's why we started this project through which the survey was done. It's called the Real Urgent and Now Project. It's a 2-year project funded by the Lord Mayor's Charitable Foundation, and its aims are to increase awareness among health professionals and the public of the impacts of climate change and the benefits of climate action on our health. To identify how people can talk about climate and health in a way that shifts attitudes and behaviours, and to help give guidance on the most effective solutions. It's been an awesome project. We've had a lot of different things come out of it. Media training for health professionals. On the left, we've got our communication guide, which has tips for health professionals and instructions on different ways that they can talk about climate change in different settings. But in order to make these resources as useful as possible and to truly understand how likely people were to do this work, we needed to get feedback from the health professionals themselves. Which brings us to this report, which we're here to discuss today. We surveyed 875 health professionals from our 5 partner organisations. So massive thank you to the Australian Health Promotion Association, the Australian Medical Students Association, Australian Nursing and Midwifery Federation, the Public Health Association, and Royal Australasian College of Physicians. We do have a panel member here to represent RACP. And the survey was designed with input from all those project partners and also especially our knowledge partners with expertise in that area. Behaviour Works Australia and the Climate Change Communication Research Hub, both at Monash University, and Sustainability Victoria. So we asked these 875 health professionals from different disciplines, how do they feel about climate change? Are they talking about climate change? Is climate change already affecting their work as health professionals? What barriers do they face in talking about this as a health issue? And what do they need from us, meaning the health sector, to best support them to do that work? So to go through the results of the survey, I'm going to introduce my colleague, Millie Burgess. Millie is CAHA's Projects and Operations Officer, and she's led the development of this survey and the report. She holds a Bachelor of Psychology and a Master of Environment and is very interested in the link between climate change, health and behaviour change. And importantly, in 2019, she worked with one of our project partners, Sustainability Victoria, on a similar survey looking at the knowledge and attitudes about climate and health among the Victorian public and the Victorian health professionals. So I will hand over to you, Mil.
Thanks so much, Remy, and hello everyone. Thanks for being here so bright and early. I'm really excited to be sharing the results of Australia's largest survey on climate and health, but first I'd just like to acknowledge the lands that we're meeting on today. Here in Nipulana, Hobart, I'm on the lands of the Mawanina people of the Southeast Nation, and I'd like to pay my respects to elders past, present and emerging. So let's jump into this. So as Remy said, the survey was completed by 875 health professionals, and that was between November 2020 and January 2021. The respondents represented all states and territories in Australia, which you can see on the slide there, but with a large proportion from New South Wales and Victoria. Almost 70% of the respondents were female, and respondents were aged 18 and over, with the most common age range being between 55 and 64 years old. Next slide, thanks Remy. So the largest proportion of respondents were nurses and midwives, followed by physicians, and then public health professionals, medical students, and then health promotion professionals. So I want to walk you through some of our key findings. Thanks Remy. And I'll go through each of these in a little more detail. But here's the short version first. Number one, health professionals are concerned about climate change. They believe that climate change is already affecting health, and they're seeing the impact of climate change to their health services. Health professionals want action on climate change now. They want to talk about climate change, but they feel insufficiently informed. They're more likely to talk about climate change and advocate for climate action if they receive training and resources. And health professionals want to receive that information on climate change from their health professional associations. So let's go through these. So what we found is more than 3/4 of respondents describe themselves as very interested in the topic of climate change. So this signals to us that they were a highly engaged group of respondents. And what we did was we divided the respondents into 4 distinct audiences according to their engagement, beliefs, and concerns about climate change. So these groups are alarmed, concerned, uncertain, and dismissive, and you can see them all in the graph here. So in general, those who are alarmed are highly engaged in climate change, and they know it's a human-caused issue, and they're already taking personal actions to address it. Those who are concerned are worried about climate change, but they don't tend to engage with the issue personally. Those who are uncertain are generally disengaged from the issue of climate change and believe it's less relevant to them than other issues. And those who are dismissive tend to be skeptical of climate change. So what you can see on the graph here is, sorry, back one slide. When you compare these segments of health professionals to the same segments in the Australian general population, you can see that the alarmed and concerned segments are much larger in the group of health professionals than the Australian population. And so next slide. When you look at these groups across different health professions, you can see that there's some variation based on profession. So for example, the medical students have the largest alarmed segment, and the physicians have the largest dismissive segment. But in general, all professions are far more alarmed and concerned than the general public. So we know that health professionals are concerned about climate change. And next slide, please. This is likely because 3/4 of respondents believe that climate change is already impacting public health in Australia. You can see some of the ways this is happening already in the image on the screen. So the circle size is related to how commonly different health conditions were reported by respondents. And what you can see is that heat stress, mental illness, respiratory illness from pollution, and bodily harm from bushfires are the most common health conditions that respondents reported seeing in their patients and clients. Not only that, but more than 80% of respondents across all professions expected these climate-related health conditions to become even more common over the next 10 years. Next slide, please. So health professionals are seeing the impact of climate change on their patients and their clients, and they know it's going to get worse. But they're also experiencing impacts to their own health services, with 56% of respondents reported that their own healthcare institution had been adversely affected by extreme weather events in the last year. So you can see on the screen there that some of the impacts from those extreme weather events were that staff were absent from work, there was increased service demand, and there were power failures. So this should all be starting to paint a picture of what a climate-fueled future might look like. Next slide, please. Now, because health professionals are seeing the impacts of climate change to health and health services, 86% agree that it's a serious problem requiring immediate action. Almost 90% of respondents indicated that the Australian government, state and territory governments, and business and industry should be doing more than they are now to protect people from climate change. Not only that, but 80% of respondents agree that the health sector should be leading the way on climate action. And in addition, 80% of respondents also believe that they have a role to play as individual health professionals in informing the public about the health impacts of climate change. They also agree that health professionals have a responsibility to bring the health effects of climate change to the attention of policymakers. Next slide, please. Now, while they might think that they should have a role in informing the public about the health impacts of climate change, less than 1/3 of respondents actually communicate to their patients, clients, or community on this topic. Now, we identified a number of barriers that help explain why the majority of health professionals aren't communicating climate and health messages. And the most common reason is that health professionals don't feel well enough informed about the health impacts of climate change. And this is also the most commonly reported barrier to advocating for climate action. Next slide, please. So when we delved into this issue deeper, we found that only 1/3 of respondents agreed that as a health professional, they are sufficiently informed about climate change and health, while only 1/5 of respondents agreed that there are sufficient education and training opportunities available to them on this issue. Yet the desire for education exists, as 3/4 of respondents indicated that they would like to learn more about the health impacts of climate change. With adequate training, knowledge, and/or resources, more than half of all respondents indicated that they would be very comfortable or extremely comfortable communicating climate health messages. Similar to this, more than half of all respondents said that they would be very likely to advocate for their institutions to reduce its emissions. As well as that, 42% of respondents indicated that they would advocate for climate action in their local community and advocate for climate action to their local member of parliament if they had the adequate training, knowledge, and/or resources. So next slide. Finally, we wanted to know where health professionals were accessing information about climate change and health. And at the moment, the most common sources were from online news, television, and professional or scientific journals. But in the future, more than 50% of respondents said that they would like to stay informed about climate change and health by their health professional organisations, and also from the Department of Health and from scientific journals. So next slide. So I've just thrown a whole heap of stats at you, but what does it all mean? Here are our key takeaways from this research. According to audience segmentation research, alarmed audiences are more likely to engage in political activism, corporate activism, and discussions about climate change. Given a large proportion of health professionals are alarmed, they are a group that can be mobilised to take action, but only with the right training and resources. Number two, While only a quarter of respondents felt comfortable talking about the health impacts of climate change, more than half said that they would be more comfortable if they were equipped with resources, training, and information. This points to the great need for quality, evidence-based resources and training specifically targeted towards health professionals in Australia. Number 3, there's a strong demand for education and training on climate change and health amongst health professionals. This could be delivered during undergraduate and postgraduate health programs and through formal continuing professional development education for health professionals. And number 4, health professional organisations were identified as one of the most preferred sources of information on climate change and health. So there's an opportunity for them to meet this demand for more information on the topic by providing targeted resources for their members on climate change and health. So using these insights from the survey, the Climate and Health Alliance will continue to work to address the key implications of this research. Thank you.
Thank you so much, Millie. That was really insightful. We've got some questions coming through on the chat. If you do have questions, feel free to put them there in the chat. And if it's directed at someone specific, do say so. We are collating these and we will have an opportunity for question and answers coming up. So upon hearing that, I'd really like to hear from our 3 panelists about what their insights are from their very different backgrounds. First up, we're going to hear from Professor Ed Maibach. Ed is a distinguished university professor at George Mason University and director of the Centre for Climate Change Communication. His research focuses on improving public understanding of climate change. He co-leads several public education initiatives, including the Medical Society Consortium for Climate and Health. And this year, he was identified as one of the top 10 most influential scientists working on climate change by Thomson Reuters. He currently serves on the board of the Global Climate and Health Alliance, of which our Climate and Health Alliance is a founding member. So I'm going to pass to Ed. Let me just stop sharing. Oh, sorry. Can't find Ed now. There we go. Thanks, Ed. You've got the floor.
Thank you, Remy. And allow me to follow suit and offer a land acknowledgement. I come to you from I live and work on the lands of the Powhatan people. And Remy, I gotta say, you give my talks better than I do. So I really feel like everything I prepared to say, you've already said better. But I'll come back and I'll reiterate a couple of those points in a moment. But first, I wanna reiterate a couple of points or extend the points that Millie made. All of the findings that she reported to you, at more or less the same time, we were conducting a similar survey in 10 countries around the world. And so everything that you've seen from your colleagues in Australia, we've seen the same thing from our colleagues in 10 or more countries around the world. Health professionals are much more engaged in the issue of climate change than perhaps we had given them credit for, much more engaged than the average members of the public, and really concerned about it and looking for ways to play a productive role in responding. And I would actually say that that as health professionals, we have a unique role to play. Remy's already started to address that, but we also have a necessary role to play. You know, we have COP26 coming up in a couple of months. The heads of state and their delegates who will be in Glasgow have got some serious work to do. And if they need to hear from us, and I'm afraid that if they don't hear from us loudly and clearly about what absolutely has to happen at the COP meeting in terms of increasing our ambitions, every country must increase its NDCs, that we're going to be that we will essentially have unleashed a slowly unfolding public health catastrophe. So the heads of state and their delegates absolutely must hear from us. And why is our role unique and possibly necessary? As Remy already said, because we are uniquely trusted. In countries around the world, survey after survey shows that health professionals are among the most, if not the most, category of professionals in those nations. Where there is no trust, there is no acceptance of information. So we have an ethical obligation to use our trusted voices to help our decision makers, our policy makers, our heads of state, and our fellow countrymen understand what the situation is. And Another part of our necessary and unique role is the situation is that climate change is not just a plants, penguins, and polar bears problem. It's a human health problem. It's a people problem. We have the opportunity to introduce people to that incredibly important perspective, in many cases for the first time. We know from our research that when people do learn about climate change as a human health problem, it's uniquely engaging. It's something most people haven't heard before. So that's why, and the reason is because we have the ability to make it personally relevant. Many people care deeply about plants, penguins, and polar bears, but as Remy said, we all care deeply about our health, the health of our children, the health of our loved ones and our neighbors. So we have this unique capability of making climate change relevant. And also, as Remy said, this is one of the few narratives about climate change that has been shown in lots of research to be uniquely effective with people across the political spectrum. Liberals, at least what we call liberals in the US, liberals tend to care pretty deeply about climate change. Conservatives in many countries care less about it. But when they learn about the human health relevance from health professionals, they find it to be interesting, engaging, personally relevant, and important. And then the last reason why we have a unique and necessary role is because when we talk about climate solutions as health solutions, it opens up a whole new set of benefits that most people had never considered before. When you talk about climate solutions as climate solutions, the benefits tend to be projected or hoped for in the distant future. But when you talk about climate solutions as health solutions, those solutions manifest almost immediately in the form of cleaner air and cleaner water and better health. And they manifest quite locally. So it's not a benefit that gets distributed a little bit all over the world. It's a set of benefits that get distributed to the communities that take those climate actions. And that's a really powerful way to change the narrative and make it much more relatable to certainly members of the public, but also particularly to the voters who put our policymakers into office. Let me share just a couple of other insights from our research. Remy talked about the importance of simple, clear messages. Well, here are five. This is what I call the 5 essential truths about climate change. That it's real, that it's human caused, that the experts in Australia and in Canada and in the US and in every country in the world, the experts based on the evidence are in agreement that human caused climate change is a reality, that climate change is bad for us, for people, but finally that there's hope. There are a lot of actions. We don't need to wait for an energy miracle. We've got all kinds of solutions that are available to us now that are going to be deliver powerful benefits, both climate benefits and health benefits. The reason why I call these the 5 essential truths, it's us, it's real, it's us, experts agree, it's bad and there's hope, is because our research shows that people who understand these 5 essential truths are much more likely to roll up their sleeves and get involved themselves in advocating for climate action. And they're much more likely to support a muscular public response to the problem. So in conclusion, I'm so pleased that we're having a conversation with health professionals today, because it's incredibly important that we lean into this unique and necessary role that we can play. We uniquely can play it. And so I encourage you to engage with others as a health professional concerned about climate change, but I also encourage you to engage in your other roles as well. Particularly if you're a parent, engage as a concerned parent. If you're whatever other roles you have, but I think the parent role is particularly strong because all of us do wear lots of hats. The most trusted, the strongest card you've got in your hand is your role as a health professional, but it's not the only card you have in your hand. So play them all, show that you're concerned, show people what kinds of climate actions are going to make a difference in producing not only limiting climate change, but also producing profound health benefits in your community today. Back to you, Remy.
Thank you, Ed. Really appreciate that. Sorry for stealing some of your lines, but I think doubling down on the message was really important. I'm going to pass now to Rebecca Huntley. Dr. Rebecca Huntley is one of Australia's foremost researchers on social trends. She runs an independent research and consultancy firm focusing on social justice issues, climate change, and the environment. And importantly, she works closely with the Sunrise Movement on the Climate Compass project, as well as many climate and environmental NGOs. So a lot of segmentation work and expertise, which we looked at in this survey. She's a prolific writer in the media and has authored numerous books, including How to Talk About Climate Change in a Way That Makes a Difference. Thanks for joining us, Rebecca. Oh, I think you're on mute.
Thank you so much for having me. I'm not going to spend a lot of time repeating some of the fantastic comments that have already been made. I just want to congratulate CAHA for this work, and a shout out to the extraordinary researchers at Monash who were not only very involved in this research, but were central to the Climate Compass work that I'm lucky enough to work on. I think what Ed's comments show, what Remy's comments show, and what Millie's comments show is there's an enormous amount of alignment between what Ed's work is finding, what the Compass finds, and what this research has found. So I'm not going to reiterate that. I'm just going to make 3 points based on some of the, I'm mainly a qualitative researcher on the work that I do. Just a couple of months ago, I was doing a focus group in the Hunter Valley. And for those people who aren't from Australia, that Hunter Valley is a place that has been built on coal. There are still coal mines there. And it's really tied up, it's at the centre of some of the toxic climate politics in Australia. I was doing a focus group where there was a man who was very resistant to climate change. He'd probably sit in the dismissive category. He'd worked in and out around the mining industry in his lifetime. He was in his mid-60s. And he said, my grandchildren have asthma, I have asthma, my kids have asthma. In my house, there is a thin layer of dust all over my house. But I don't believe we can move out of coal because I don't believe that I'm going to get a job or my kids are going to get a job if mining leaves this industry. This was a man for whom messages around the connection between well-being, physical and mental well-being, and climate, it should have been a very easy target, but for whatever reason, the way we talk about climate change pits environmental and climate concerns against economic interest. That's slowly changing, but we certainly need to talk, we certainly need to break that barrier down, more importantly. And just to build on Ed's point about the power of parents speaking out about climate, I'm on the advisory board of Australian Parents for Climate Action. We have a fantastic woman in the Hunter Valley who does really great work around having all these images of all the kids in the Hunter Valley who are more likely to have asthma because they live in the Hunter Valley and not in Sydney. She's finding new ways to talk about climate and health that tries to sidestep some of the really difficult questions around what's going to happen with the transition away from fossil fuels to renewable energy, what's going to happen to the labour market as part of that. So we have healthcare professionals in and out of areas where the health impacts of climate are particularly acute, have a role to play in that broader discussion. The second thing that really struck me, the alignment between what's happened in this research and what we find in the Climate Compass, is that medical students are the most alarmed. And that just shows a wave of a new generation of Australians and young people around the world for whom climate is a top order issue and at the centre of so many other issues. When we cut the Climate Compass by age, Australians under 25, only 1% of Australians under 25 would be described as dismissive or deniers. So the future of the medical and healthcare profession, whether it be physicians, nurses, first responders, or indeed patients, is that climate change is central. So I often say when I do work with people in the medical health profession, whether you like it or not, young patients are going to come to you and climate change will be part of what they are thinking about when they think about their mental and physical health. And finally, and the thing that always strikes me as another really kind of clear alignment between this work and the Climate Compass and the work that I do, qualitative work on research, it's one of the biggest barriers to people who are absolutely alarmed about climate is they don't necessarily feel like they have the confidence either to understand the climate science or to communicate. In fact, for the alarmed in the Climate Compass, it's one of the biggest barriers. That barrier to talking more about climate or doing more is I don't have good writing or good language skills. This is not a barrier that troubles people who are climate deniers. So I always say to people who are concerned about climate and want to talk about it, I want you to channel the self-belief of climate deniers in that you have the right to talk about it. You probably know enough to talk about it, but the most important thing, refine your own climate story. Start with that. How do you make the connections between your health and happiness and climate change? Educate yourself. There's so much information out there about what's actually happening, and go forth with the confidence of a climate denier to talk about the connections between climate and health amongst your peers, amongst your family and friends. It's not easy, but it is essential. Thank you.
Go forth with the confidence of a climate denier is just my mantra. Like, that's amazing. I'm putting it on my Twitter bio. Wow. Thank you for that, Rebecca. And what you were saying about confidence was really reflected in our results. That was the biggest barrier for health professionals to do this work, that they didn't feel that they knew enough. And we know that health professionals are very scientifically evidence-driven. It's a very evidence-based profession, of course, and they feel like they need a lot of knowledge to be able to step into that role. So really important that we give them the tools that they need to do this work. I'm going to pass to Lynne, Professor Lynne Maide. She is here representing the Royal Australasian College of Physicians, and who is one of our project partners. Lynne is a public health physician and the chair of the Climate Change and Health Research Project Advisory Committee, which comprises representatives from the RACP and 9 other medical colleges. She's the inaugural Professor of Population and Planetary Health at the University of Notre Dame, Australia. And she's leading the development of a new Master of Public and Environmentally Sustainable Health, which will be offered as a nested suite of programs. So welcome, Lynne, and I will control your slides from over here.
Thanks very much indeed, Rebby. Thank you very much indeed for the invitation to the RACP to join this tremendous session this morning. And I contribute from the lands of the Gadigal people in Sydney. Remy, if you move on to the next slide, thank you. So climate change and health is a strategic policy and advocacy priority for the RACP. The role of the college is to bring medical expertise and a focus on human health and justice to the centre of public policy as it relates to climate change. RACP members guide our climate change and health work, and we have 2 climate change and health reference groups that have slightly different contributions to each other. Interest in climate change has increased across the college in recent years, and we seek to build that interest and understanding amongst our members by events and also at our regular congresses each year. This allows us to draw down the expertise from the 33 medical specialties that make up the college, including public health, adult medicine, and paediatrics. We've developed 3 position statements on climate change and health, and these inform our advocacy positions, and they are listed here on the slide. And this advocacy work is primarily directed at the Australian government. And what we're seeking to do there is to bring health to the centre of the climate change discourse. Our current calls for action are actually there listed, but they are for a national climate change and health strategy to coordinate action on health-specific climate adaptation and mitigation action across the country. And also for an urgent transition from fossil fuels to zero emission renewable energy across the economic sectors, recognising that we must support the transition in affected communities. It's important also for the college to demonstrate action, and in 2015, it divested all financial holdings from fossil fuels, and we did that before the COP in Paris. And the college is committed to reducing its own carbon footprint and increasing the sustainability of health services through skilling our members. We contribute to significant climate and health projects because we seek to help build evidence. And for example, since its inception, we've contributed each year to the Australian policy brief of the MJA Lancet Countdown, the country-specific policy brief. We also regularly respond to public consultations, for example, the WHO's draft COP26 special report, the health argument for climate action, and the Victorian Government's Health and Human Services Climate Change Adaptation Action Plan. Remy, if you'd move to the next slide, please. Thank you. We also seek to contribute to building that evidence base, and this year, a key priority is our Climate Change and Health Research Project. This project will produce a research report on the risks of climate change to the Australian healthcare system and how best to manage these risks. We've invited and been joined by 9 other medical colleges who are participating in the project, and all have members on our advisory committee for this project. We've engaged the Monash Sustainable Development Institute and CAHA to undertake this work, which comprises 3 discrete research projects: a systematic rapid review of how health systems are responding to the threat of climate change, a series of case studies, and a policy and institutional analysis. So early findings from this show that despite a growing number of players taking action to address the impacts of climate change, coordinated system-level action is lacking. The case studies are very poignant, and many of them would break your heart, and so are compelling. They include responses to the Black Summer bushfires, the rising sea levels in the Torres Strait, and the compounding impacts of drought, heat, fire, and the pandemic in local communities, particularly rural communities. These case studies make the strain of climate change on the health system and on health workers very, very clear. Our goal is to unite medical colleges as a collective force for advocacy around this report, emphasising that climate change is a health issue requiring decisive action urgently. And we aim to release this report in time for COP26 in Glasgow. We believe that a unified health voice is a stronger advocacy voice, and therefore we are a member of CAHA. And so consequently, for these reasons, the college joined the RUN project. Thanks very much indeed.
Thank you, Lynne, for joining us and going through some of that work that a really important part of the health sector is taking on. And on that note, I just wanted to finish this section before we get to questions, talking about this message. And I think that what Lynne has just said demonstrates how true it is. Climate change is a health emergency, but as a health professional, your voice counts. Speaking of simple messages repeated often by trusted sources, this is a simple message that the Climate and Health Alliance repeats throughout its RUN project, because climate change is a health emergency, but we want to put health professionals back into the solution and empower them to do that. And it's amazing to see the work that the Royal Australasian College of Physicians is doing to lead in this space. So thank you very much. That concludes just the presentations. And I'm going to get all of our panelists up, put a spotlight on them and just ask them a few questions. And thank you to everyone putting excellent questions in the chat. We really appreciate it. Sorry, just playing with a couple of screens here. I'm combining a couple of questions here, and I'll start by directing it to Ed, but anyone can jump in. We got a comment in the chat saying from someone who feels confident talking about climate change, but is a speech pathologist, and was asking the question, how do you broach this topic in a consultation session? And I think more broadly, how can health professionals talk about climate change in the context of their work?
It's funny you should put that question to me, Remy, since I'm a public health guy and I don't actually deal with patients, but I will admit that until quite recently, I was a bit of a skeptic myself that clinicians, people who do see patients, should in fact bring this topic up during a consultation. But I am no longer a skeptic. I've collaborated with a pediatrician in Madison, Wisconsin, a fairly conservative part of America. And he did a little pilot test. As a pediatrician, he spoke to about 250 consecutive patients or families in his consultation room. He developed about a 45-second script in which he explained the health relevance of climate change, and he made some recommendations. And he then surveyed those patients after the fact to find out how they reacted to his little consultation about climate and health. And the reactions that he got from his patients were overwhelmingly positive, even from his conservative patients. So while I was a skeptic before, I am now a convert. I think it's a great idea, but I'm also an empiricist, so I think we should put a little bit of energy into figuring out exactly how best to introduce this conversation into a consultation. And of course, there are all kinds of different consultation, well baby visits, well children visits in the case of this pediatrician, but there are a lot of other type of clinical encounters. So I would really love to see CAHA and the Royal Academy and others put some energy into figuring out exactly how best to introduce this topic in a consultation.
I'll throw to Rebecca, who has her hand up. Yeah, so in some of the work that I've done with the kind of health professional groups around climate, and particularly within the context of consultation, so GPs, they often say that it is really difficult and they never know how people are going to react. They do sometimes talk about the power of having some material just in the office, sitting there, and whether that be posters or flyers or whatever, and to see whether that gets picked up by the patient. But this is where I think the kind of the network of either patient advocacy groups or condition advocacy groups can be very effective. I mean, what might Asthma Australia, given the respiratory health issues or the medical or the mental health issues associated with climate, we already know a lot of those groups are doing things, and from the patient point of view as well. So I think that's helpful. I mean, I think that the concern that clinicians have about raising this in a way that might upset people within the context, I mean, you may not want to mention it when you're giving in a prostate exam, or for example, cough and let's talk about climate change. But so you've got to make your timing. I think that's certainly right. Only a really dedicated person would want to talk about climate change during a pap smear. But I think that there are other ways to approach these kinds of issues. And I think, again, it's about creativity, and it's about those kinds of wonderful case studies that Ed talked about to give people confidence that there is a way through.
Awesome. Lynne, as representing, physicians in Australia, do you have how do you think health professionals can bring this up when they're doing their work?
Well, I think that one of the things and one of the reasons why we were talking about trust, I think that one of the things that people expect from physicians and other health workers is that they come from an evidence base. That basically you're not kind of making it up as you go along, that in fact that you're speaking from a position of authority, and that position of authority is an informed position. But there is a nexus, which I think is very powerful, and which both Ed and Rebecca have spoken about, is that what you bring to that evidence-informed position or understanding, which of course is constantly evolving because as the evidence evolves, and that's one of the great challenges, it is what you bring is your experience of knowing that how this is affecting people. So you also bring that sense of the immediacy, and you also bring the sense of what the threat is to them. And so it's that combination, I think, of the evidence and the emotion that I think is very powerful in the health voice.
Fantastic. Thank you for sharing. Mil, do you want to add anything to that, or?
No, I think that Ed and Rebecca and Lynne have all made really great points. I do just want to read out the comment that's in the chat from Angela Evans, though, who said that she's a podiatrist and introduced the topic with a pun about reducing our carbon footprints, and as feet are equipment for walking or running and riding, carbon-free transport that also builds health. I think that's great, and we love to hear things like that, different ways that people are working in these conversations about climate into their own profession.
Fantastic. Yeah, puns go a long way, and in making friends, or at least in my experience. And yeah, I will just note to any registrant, we will send around our run communications guide afterwards, which has some specific tips of how to bring this up in clinical settings. I'm just going to share my screen quickly again. We've had a question from John about this dismissive segment in physicians. It's about 20%. I just want to say that, of course, many more physicians are alarmed or concerned than dismissive. But we've had a question about the data breakdown of that. I will throw to Millie, though I suspect that that might be a question that we need to get back to John on. But I'd also like to get input from Lynne as to if she has any insights, if there's any demographic forces that mean that physicians possibly are more dismissive than other groups. Lynne, Millie, the question was, do we have a gender and age breakdown for physicians that might contribute to it being a different segmentation?
So to my knowledge, we haven't done the stats on that, but I think it's something that we could go back and have a look at if that's something that really interests people. Okay,
awesome. Lynne, any insights? What are your thoughts on what's happening here?
Well, a couple of things. I think, I mean, the total sample was 800. And so you're looking at about 200 physicians there, or around 200. And just remember, there's 20,000 physicians inside the Royal Australasian College of Physicians. That's physicians and trainees. So you're looking at a very small sample. So I think that one does need to be a little careful about interpreting the results, even though it's a big survey. I think when you start breaking it down into professional groups, you're looking at very small samples here. So I think that would be the thing I would use. I would just be cautious about interpreting small numbers for any of these groups here, to be quite frank. But the other thing, but then on the other side, I would put is that, you know, and I don't know whether that breakdown is in the physicians or trainees, but as the sample also showed, you know, that medical students are actually, who are the coming generations of physicians, surgeons, anaesthetists, dermatologists, they are much more engaged and concerned. You know, to some extent, as you all know as well as I do, the health voice and the health awareness about the health effects of climate change really only got started in about in 2015, 2016. The Lancet Countdown has been very important, as Ed was inferring, to actually bring the health story into the whole climate change space. So you remember, when you've got large cohorts of health professionals, you're bringing them along at the moment. They haven't had an education that included climate change and health. And that's what we've got to start doing, is that we need to start embedding this into the education of all our health professionals. And the best way to do that is to make certain that the accreditation standards for all these regulated health professions, so in Australia and New Zealand, all these health professions are regulated. So they're held by accreditation standards. Do our accreditation standards currently have climate change and health in them? No, they don't. And so a really important point for advocacy is two groups like the Australian Medical Council and the Nursing Accreditation Standards to get climate change inserted into those. And then change has to happen.
Thanks, Lynne. I'm going to move on to the next question. We've had a few comments in the chat along this vein. You know, surprised that educated people aren't able to use the wealth of information out there to push this case. People talking about the value of saying, listen to the 97% of scientists. I wanted to throw to the panel, why doesn't this work and why do we need to expand? You know, this conversation has been happening for decades. Why do we need to expand the way that we talk about it so we're not just throwing sort of the climate science at people and hoping that they'll change their mind? Anyone interested can take that.
So ExxonMobil finds its way into my Twitter feed and into my newspaper, into my public radio station many times every day. And why do they do that? Because they want to convince people like me that they've got this. It's okay. They know that climate change is a problem. This is new for them, by the way, but their new narrative, their new rhetoric is, we've got this. Go back to sleep. It's okay. And simple messages repeated often by a variety of trusted voices. Big oil and big coal have the ability to get their messages repeated often because they buy their way into our attention spans. And that's why it's so important for those of us who are trusted and who actually have science on our side to use our trusted voices to convey simple, clear messages, to make it really clear that no, actually they don't have this. They're continuing business as usual, and that is plummeting, you know, planet Earth right off, I'm mixing my metaphor here, but it's plummeting planet Earth over a cliff. And we need to drag that back and decarbonize our communities, decarbonize the global economy. And in doing so, we will solve this problem. And moreover, we will create unbelievable human health, well-being, and prosperity like we have never seen before.
Rebecca, would you like to?
Yeah, look, I've often reflected on this around why is it that people who are alarmed about climate change, which, and I don't want to generalize too much, but some of the research shows they're often the most educated people and they're getting information, correct information about climate change from a variety of different sources, why they feel they don't know enough to speak out. And I think it's the flip side of a good thing, which is they really admire expertise. They believe climate change is happening because they know so many people who do PhDs, which they don't hand out in cereal boxes, say that it's happening, talk about the connections. So almost the barrier for speaking about it is higher. But of course, one of the problems is that the idea that there might be very simple messages that we might boil down quite complex and expert opinions to simple messages, and perhaps a little bit of a cynicism about marketing and advertising as well, kind of the techniques around that, means that we often get tied up in knots, right, around this. And it's not the thing that troubles the people in the coal, oil and gas industry. They know the power of public campaigns, blanket advertising, which we've had in Australia for 30 years, saying that we are a country that cannot survive without coal and gas. Under no circumstances are we a country that can have jobs and prosperity in a future if we move away from coal and gas to renewables. I see it time and time again. It doesn't matter how much evidence you put in front of people, it is hard for them to get their head around it because there's been such effective marketing campaigns with simple messages repeated often for so long. So I'm not saying that people who are concerned about climate change have to deal with lowest common denominator, approaches to this. We are not in a post-fact world. We are not in a fake news world. We still need to look at the evidence. We still need to take it seriously, but that doesn't mean that we can't find effective ways to communicate and use some of the techniques that the coal, oil and gas industry have used for generations, for decades, to get our message across, because our message is we've got the evidence on our side and we've got the public benefit on our side as well.
The other thing I would just add is that I think that we also still have a job of communicating or engaging within our own sector. So I'm talking here about the health sector. I'm talking about the health and education sectors, to be quite frank. And I think there's a lot to also learn from the NHS and the way that they've gone about it. I mean, they've been steadily working at this engagement process within their own sector for the last 10 years. And they continually refine the way that they're developing and normalising the work around climate change and the need to respond within the health sector. And so their current sort of message, which is aligned with their new sort of targets, which is to be net zero by 2040, is to say that this is now core business. So even though, you know, they've been, like everyone across the world, sort of battling sort of the COVID response, and we've all seen the dramatic effect that COVID has had in other countries beyond Australia and New Zealand, they have continued to work on climate change. They see this as COVID's one of their in-the-face current issues, but so is climate change and climate action. And so they are now referring to it as their core business. So talking about a simple message, they just simply are saying to their people, this is core business. And they have remarkable engagement. Something like 98% of their workforce believes that not only is this the business of the health sector, but in fact that the health sector should be doing more. And I think in our country, here I speak about Australia, I'm not sure we've actually anywhere near achieving that.
Okay, thank you so much for sharing. I am noting that we've got 1 minute to go. Millie, do you have anything you'd like to add, or?
Yeah, I guess one thing that I have been thinking about is, you know, making messages personal for people so that they understand what the impact of what the impact of climate change will be for them and their health and the health of their, you know, their grandparents or their kids, bringing it back to being personally impacted by climate change, I think makes it really real for people rather than kind of a far off distant issue. And again, showing that health is an important lens through which to view climate change, and because it will impact everyone and their health.
Thank you, Mill. That is a really good note to end on. We want to get health professionals talking about climate change to make it real, urgent, and now in people's minds. Thank you so much for joining us, for many of you early in the morning, but also at different times for people all over the world. We have a lot more questions we couldn't answer, so I will be going through today and tweeting out some answers to some of those great questions. So if your question didn't get answered, head to our Twitter feed and see if you can find the answers there. And I would really sincerely like to thank our panelists, Professor Ed Maibach, Dr. Rebecca Huntley, and Professor Lynne Maide for joining us today, and to Millie for really excellently and succinctly articulating and summarising our survey results. And I'll send around an email after this with the survey, the communications guide, and a recording that you can disseminate. Thank you all.
Thank you.
Fiona, would you like to stop recording?